So, after studying this module, you should be able to know the history of behavior therapy, understand the principles of behavior therapy, learn about the basic assumptions of this approach, have an insight into the role of the counselor, analyze the key techniques of behavior therapy, and finally evaluate the approach. Behavior therapy comes under the larger rubric of action-oriented methods that help people change the way they think and do things. These are called as action-oriented as they rely on behavior-specific interventions and outcomes. The behavior approach has its beginnings in the 1950s and the early 1960s. It started as a school of thought disagreeing and departing from the widely popular psychoanalytic approach. Behavior therapy applied its principles of classical and operant conditioning to the treatment of problem behaviors. Modern behavior therapy is focused on giving control to the clients and help increase their skills to overcome the debilitating effect of behaviors. The theory of behavior therapy is based on the belief that all our values, attitudes, preferences, emotional responses, thinking patterns, personality styles and problems are all resultant of learned behavior. In this perspective, a maladjusted person is seen as having failed to acquire appropriate coping skills, having learned faulty coping patterns and or both. Human behavior is shaped, reinforced and molded by the world around us. Hence, a systematic and scientific approach is used to identify specific behaviors that need to be changed, set desirable and achievable goals, collect data on clients' functioning levels, design a behavior modification module, decrease clients' resistance, modify distracting variables, monitor the impact of module and make changes if required in the treatment plan. Let us first come to the basic assumptions of behavior therapy. Number 1. Behavior therapy is based on principles and procedures of scientific method, such as learning principles. It states treatment goals in concrete and objective terms. The concepts and procedures are explicitly stated, empirically tested and continually updated. Another assumption of behavior therapy is that it deals with the client's current problems and the factors influencing them. Clients are expected to engage in specific actions to deal with their problems. They monitor their behavior both during and outside the therapy sessions. They learn and practice behavior and coping skills and do role play to learn the new behaviors. Thus, it is an action-oriented approach. Another assumption is that it is carried out in the client's natural environment and it is largely educational in nature. It teaches clients skills of self-management. Homework assignments are an integral part of behavior therapy. Behavior procedures are tailored to fit the unique needs of the client is another assumption of this approach. Lastly, the practice of behavior therapy is based on a collaborative partnership between the therapist and the client. Clients are trained to initiate, conduct and evaluate their own treatment under the guidance of the therapist. Now, let us come to the role of the therapist in a counseling session. A behavior therapist is active in the counseling sessions. Hence, the client learns, unlearns and relearns specific ways of behaving. Counselor functions as a teacher, consultant, advisor, reinforcer and facilitator. He or she may instruct or supervise, support people in the client's environment who are assisting in the change process. The therapist must also model appropriate behaviors as he serves as a person worthy of emulation. Hence, the therapist must be aware of the crucial role and power they have in influencing the client's way of thinking. Behavior therapy also demands a high level of skills and sensitivity from the counselor and an ability to form a working relationship with the clients. Well students, now let us study some key techniques of behavior therapy. One of the first techniques is extinction. The basic principle of extinction involves elimination of reinforcement for the maladaptive behaviors. Two specific techniques are implosive therapy and flooding. Implosive therapy is an advanced technique that involves desensitizing a client to a situation by having him or her imagine an anxiety producing situation which may have dire consequences such that there is massive implosion of anxiety. The client is now taught to relax first. With repeated exposure of stimulus in a safe setting, the stimulus loses its power to elicit the anxiety and the neurotic avoidance behavior is extinguished. It is also called in vitro or lab or clinic setting desensitization. Flooding or in vivo is less traumatic as the imagined anxiety producing scene does not have dire consequences. It can be used for people who cannot imagine scenes realistically. For example, a client with phobia of heights may be taken to the terrace of a building. Hence, the client is made to realize that the feared consequences do not occur and it is a simple treatment choice for simple phobias. Now let us come to the second technique, systematic desensitization. It is designed to overcome anxiety in particular situations. The term systematic refers to the carefully graduated manner in which the person is exposed to the feared stimulus. A client is asked to describe the situation that causes anxiety and then rank the situation and related events on hierarchical scale from least anxiety to most anxiety provoking event. The client is taught to relax physically and mentally. The client is then exposed to the situation which are least provoking and learn to relax at the same time. Since anxiety and relaxation are antagonistic, the client will experience either one. This is done till he is relaxed in the first situation. The therapist then moves on to the next anxiety provoking situation. This is done till he masters the task of staying calm and relaxed even in the most anxiety provoking situations. The sessions conducted are usually for 30 minutes and often 2 to 3 times per week for a number of weeks or months. Sometimes it is used in groups which is referred to as marathon desensitization groups. Now let us come to the third technique, which is aversion therapy. Aversion therapy involves modifying undesirable behaviors through punishment. It involves either the removal of desired reinforcers or the use of aversive stimuli, which the client does not like. The basic idea is to reduce the temptation value of stimuli that elicits undesirable behavior. It can be done through the use of mild electric shocks or drugs. It is mostly used for behaviors such as smoking, drinking, overeating, drug dependence, gambling, sexual variance and bizarre psychotic behaviors. Now let us come to the fourth technique, modeling. It involves learning of skills through imitation of behavior of others. Usually the parent, therapist or peers perform the behaviors and the client observes and imitates the behaviors. For example, a child suffering from mental retardation may be taught self-feeding through modeling. The term modeling, observation learning, imitation, social learning and vicarious learning all refer to the process by which behavior of an individual or group acts as a stimulus for similar thoughts, attitudes and behaviors on part of the observer. Bandura outlines 3 effects of modeling. First is the acquisition of new responses or skills and the performance of them. Example, learning the skills in sports, language patterns, training autistic children to speak through the use of models, social skills and teaching hospital patients coping skills necessary for their return to the community. The second effect is inhibition of fear responses, which occurs when the observer's behaviors are inhibited in some way. Here the model averts the negative consequences and have positive consequences. Example, handling snakes and not being bitten by it, or performing feats and not getting hurt. Also, workers who strike and do not lose job, then others may follow the same. The third effect is the facilitation of responses, in which the model provides cues for others to emulate. The effect is to increase behaviors that the individual has already learned. Example, attractive teenagers advertising for jeans. Others watching may follow the same fad. Also, for example, when the person who leaves a social gathering, others may follow the same. Now let us come to the next technique, which is systematic use of reinforcement. Let us first understand what are reinforcers. Reinforcers are those events that, when they follow a behavior, increase the probability of the behavior being repeating again and again. It may be positive or negative. Reinforcers can be effectively used to elicit and maintain behaviors. Under this, we will study how schedules of reinforcement can be used to modify behavior. What are schedules of reinforcement? When a behavior is first being learned, it should be reinforced every time it occurs. This is called as continuous reinforcement. After it is established, intermittent reinforcement is given. Schedules of reinforcement operate according to either the number of responses, that is ratio, or the length of time, that is interval, between reinforcers. Both ratio and interval are either fixed or variable. Under this, we also have response shaping. A behavior is learned gradually in steps through successive approximations is known as shaping. When clients learn new skills, counselors may help break down behavior into manageable units. Coming on to the next technique, token economies. Sometimes intangible reinforcers are ineffective. Hence, tangible reinforcers may be used in the form of tokens that can be exchanged for desired objects and privileges. It has been used to establish adaptive behaviors ranging from elementary responses such as eating and making one's bed to the daily performance of responsible jobs. Tokens have certain advantages. These are: the number of tokens earned depends directly on the amount of desirable behavior. Second, tokens like money have value in the outer world and can be used with children and other people who value money. And third, tokens can reduce the delay between appropriate performance and reinforcement. It has been effective in managing behavior of patients with chronic schizophrenia and mental retardation. Coming on to the next technique, behavioral contracting. Also called as contingency contracts, these contracts spell out the behaviors to be performed, changed or discontinued in writing. The rewards associated with achievement of these goals and the conditions under which the rewards are to be received. It is helpful as the structure of the treatment is stated, the responsibility of the client are outlined, and the system of rewards is built in. The length and the focus of sessions are specified, and the criteria for determining success or failure can be seen. Now let us come to the next technique, assertiveness therapy. It is based on the idea that a person should be able to express his thoughts and feelings appropriately without feeling undue anxiety. This technique consists of counter-conditioning anxiety and reinforcing assertiveness. The client is taught the difference between being aggressive, passive and assertive. In therapy, the desired behaviors are first practiced in the therapeutic setting. Then, through the therapist's guidance, the individual practices new behaviors in real life setting. It focuses on developing appropriate and effective interpersonal skills. Now let us come to the next technique, biofeedback treatment. The physiological responses such as heart rate, galvanic skin response and blood pressure are involuntary. In this approach, a person is taught to influence his or her own physiological processes. It involves the following steps. First, monitoring the physiological process that is to be modified. Second, converting the information to a visual or auditory signal, and C, providing means for feedback. Looking at the feedback, the subject then reduces undesired anxiety or response. It requires investment of capital to purchase complicated equipment. Although there is some agreement on the effectiveness of this approach, however, some researchers claim that the results are often small and not generalizable to other situations. Now let us study some principles of learning and their meanings. First, generalization. It involves a display of behavior in environments outside where they were originally learned. Example, at home, at work. It indicates that the transference into another setting has occurred. Coming on to the second principle, maintenance. It is defined as being consistent in performing the behavior without depending on anyone else for support. Here emphasis is on client's self-control and management. It is done through self-monitoring, involving self-observation, that is requiring a person to notice particular behaviors he or she does, and self-recording, that is focuses on recording of particular behaviors. Coming on to the next principle, rehearsal. Rehearsal consists of practicing a desired behavior until it is performed the way the client wishes. Coming on to the last principle of this technique is covert sensitization. It is a technique in which undesired behaviors is eliminated by associating it with unpleasantness. Well students, now we have studied the key techniques and we should now know the evaluation of this approach, that is the strengths and limitations of this therapy. Let us first study the strengths of this approach. The approach deals directly with symptoms. Because most clients seek help for specific symptoms and problems, counselors are able to assist clients immediately. Another advantage of this approach is that it focuses on the here and the now. A client does not have to examine the past to obtain help in the present. Also, it has been found that this approach is economical and saves both time and money. This approach also offers numerous techniques for counselors to use. Also, this approach is based on learning theory, which is well formulated way of documenting how new behaviors are acquired. Another advantage of this approach is that it is supported by extensive research on the effectiveness of its techniques. In addition to this, the approach is objective in defining and dealing with problems and demystifies the process of counseling. And finally, it has been well established, showing empirical evidence of its effective treatment of chronic pain, panic disorder, generalized anxiety disorder, phobias, OCD, tension headaches, irritable bowel syndrome, female orgasmic dysfunction and male erectile dysfunction, etc. Now let us come to the limitations of this approach. First of all, this approach does not deal with the total person, just explicit behavior. It changes the behavior but not the feelings. Another limitation is that it is sometimes applied mechanically. The importance of the relation between the client and the therapist is ignored. Another limitation of this approach is that it is best demonstrated under controlled conditions that may be difficult to replicate in normal counseling situations. Also, this approach ignores the client's past history and unconscious forces. Another limitation that has been found is that it does not provide insight. Some clients want not just to change behaviors but also gain understanding of why they behave the way they do. Also, this approach does not consider the developmental stages. Another limitation is that it treats only the symptoms rather than the causes. Another is that it involves control and manipulation by the therapist. Final limitation of this approach is that it programs the client towards minimum or tolerable levels of behaving, reinforces conformity, stifles creativity and ignores the client's needs for self-fulfillment, self-actualization and feelings of self-worth. Well students, now let us summarize what all we have learnt in this module. Number 1. The behavior therapy is one of the action-oriented methods that help people change the way they think. Behavior therapy started as a school of thought disagreeing and departing from the widely popular psychoanalytic approach. Behavior therapy has its applied principles of classical and operant conditioning and it treats problem behaviors. The modern behavior therapy focuses on giving control to the clients and helps increase their skills to overcome the debilitating behaviors. The theory of behavior therapy is based on the beliefs that all our values, attitudes, preferences, emotional responses, thinking patterns, personality styles and problems are the result of all learned behaviors. Also, in this perspective, a maladjusted person is seen as having failed to acquire appropriate coping skills, b. having learned faulty coping patterns which are maintained by some kind of reinforcement or both of these. Also, it believes human behavior is shaped, reinforced and molded by the world around us. Hence, a systematic and scientific approach is used to identify specific behaviors that need to be changed, set desirable and achievable goals, collect data on clients' functioning levels, design a behavior modification module, decrease the client's resistance, modify distracting variables, monitor the impact of the module and make changes if required in the treatment plan. Extinction, systematic desensitization, aversion therapy, assertiveness therapy, modeling, systematic use of reinforcement, token economies, behavioral contracting, biofeedback treatment are some of its key techniques. The greatest strength of this method is that since target behaviors are specified, the results can be easily evaluated. Also, this approach is economical for both time and money. The limitation of this approach is that it cannot be used to treat access to personality disorders where specific symptoms are rare. However, overall it is a very effective approach and a preferred line of treatment for many behavioral problems.